Calcium channel blockers are great for managing angina. They cause vasodilation, which increases blood supply to the heart. Plus, rate-limiting ones like verapamil also reduce oxygen demand.
But I have heard there are some rules about combining them with other treatments.
Plus, rate-limiting ones like verapamil also reduce oxygen demand. Yes, verapamil should generally be avoided if a patient is already on beta blockers because it can increase the risk of a systole. But if they're not on beta blockers, it can be quite effective.
And what if beta blockers aren't enough on their own?
If that's the case, we often add a dihydropyridine-type calcium channel blocker, like nifedipine or amlodipine. They don't have the same risks as verapamil and help manage your symptoms better.
What's the deal with all these different treatments?
Nitrates, angina. They cause vasodilation by releasing nitric oxide. For rapid effect, we use them sublingually, like glyceryl trinitrate sprays or tablets. For long-term management, we use long-acting nitrates, like isosorbide mononitrate, which are taken orally to prevent symptoms over time.
And what about nicorandil and ivabradine?
Nicorandil activates potassium channels, causing coronary artery vasodilation. It's effective, though we don't have as much long-term data as with other treatments. Ivabradine affects the IF channel, which helps control heart rate. It's a newer option and can be useful if beta blockers aren't suitable.
What about the other stuff you mentioned?
Antiplatelet drugs like aspirin and clopidogrel help prevent cardiovascular events. Statins lower cholesterol and have additional benefits like anti-inflammatory effects. ACE inhibitors, while not helping with angina directly, reduce cardiovascular risk.
And if medication isn't enough?
If drug therapy fails, we consider procedures like coronary artery bypass grafting, CABG, or percutaneous coronary intervention, PCI. CABG uses vessels from elsewhere in the body to bypass blocked arteries. PCI involves balloon angioplasty and stenting to open up coronary vessels.
So, lots of options to manage and control me.
Exactly. We have a range of tools to keep you in check and protect the heart.
As a patient using long-acting nitrates, it's important to have a nitrate-free period, usually by scheduling doses in the morning and early afternoon. Regular reviews with your healthcare team will help monitor your symptoms and adjust your treatment as needed. If symptoms remain uncontrolled, an additional agent may be prescribed, and if 2 medications fail, referral to secondary care might be necessary for further management. Be aware of potential side effects. Beta blockers can cause cold extremities and fatigue. Nitrates might lead to headaches and dizziness, while calcium channel blockers may cause constipation and swelling. Nicorandil and ivabradine are generally well tolerated but can cause headaches or dizziness. Always work on optimizing other cardiovascular risk factors as part of your overall treatment plan.
As a patient with angina, it's crucial to understand your condition, its symptoms, and the potential for more serious cardiovascular events. Recognize the signs of a heart attack and act fast if needed. You'll receive guidance on managing risk factors like smoking and weight, as well as advice on safe exercise techniques. Your medication plan, including how to use nitrates properly and potential side effects, will be explained in detail. Never stop beta blockers abruptly, as it could worsen symptoms. Be cautious with medications like nicorandil, which may affect your ability to drive. Most importantly, if your chest pain lasts more than 5 minutes and doesn't respond to glyceryl trinitrate, call emergency services immediately.